questions. So I'm just gonna go around the table. Is this the one? Okay, all right. Okay, I'm gonna start with Jason. Is Parks and Rec involved with the upcoming Miracle League field?
So we're not as involved as we would like to be, but we're constantly trying to build. We're not as involved as we would like to be. We're constantly trying to build relationships. We think we can offer some recreation programming there. We think it's a great field, and it's right next to it. It's actually right next to some city-owned property that we plan to develop after the field is there to showcase health and wellness for adults and potentially some adult playground equipment, so people that are playing at the park can also have the adults get healthy next to it.
Gayle, this will be for you. What was your hardest day in 47 years? What was your best day?
That day's upcoming.
In the back of my mind, I was going, the best is yet to come. My hardest day, I think, was when I became health director in 2009, right after the economic crash, and we were trying to decide how we were going to reduce our budgets in order to deal with the impact of lower revenues. And we had been holding positions vacant in anticipation of something terrible happening. And I thought that we'd just hold them vacant. And I was dreading the fact, I literally cried after I got the job, that I was gonna have to lay off all these people. It's like, how do you do that? I mean, it was like, oh, get a grip. But I mean, it was like, am I going to be contributing to families being in worse situations? And so having to do that shortly after I was put into the position just did not feel good. And we decided that we would just hold those positions vacant that were already vacant. I think we had 22 positions that were vacant. And I said, so we'll just give these up. They've been vacant, they've been frozen for 6 months, and we'll just keep them frozen. And then I walked into a budget meeting, and the then budget analyst said, you know, those positions we were going to freeze. Well, they just kind of took them. And they thanked me, saying, I just messed up all the equipment. They gave me back 4 school nurses, but they took the other 18 positions. But it did keep me from having to actually lay people off, because that would have been really, really hard. And anytime I have to have a personnel discussion that results in people having to leave the organization, that is always hard, but then you have to figure out that you're there for the good of the organization. And anybody who leaves the organization, they go to the commissioners, you won't believe what Gayle did. No, it wasn't what Gayle did. I give people a tremendous chance. I go through all of the possible options, and then HR helps me write up this really long letter that said, you know, back in the day we started. And so I tell people to actually ask them for the documentation that shows that we really tried to work closely with them to keep them employed. And I've had so many best days, it's almost unreal. I've had this 47-year career, still excited about the work that I do, or have been a part of, and still excited to know about the work that is going to be happening. So I got a lot of good days. I am really, really very lucky.
Thank you. So Ben, this question is for you. What does county run, state supervised mean?
So basically, in North Carolina, we are one of probably only about, I think there's maybe 12 states that have our system where social services is actually administered at the county level by county departments. Most states, it's actually administered by the state themselves. Now, they have offices probably in every county, but they're state-run offices, they're state employees. So North Carolina is a county administered state supervised system where basically county government operates the programs, they hire the staff. Like I said, we're county employees. We have governance at the local level. But the state, since our programs are so dependent on federal dollars and tied to federal rules and regulations, the state actually has supervision authority over the programs. So basically their job is to ensure that we are administering the programs correctly. Therefore, they review us, they audit us, they test us on a regular basis at all levels of what we do. I didn't even talk about child support. We do child support. We had Amnesty yesterday where we actually collected about $11,000. Well, child support's a federal program. It's based in the Social Security Act. So we are local child support agents, but we have a state consultant that comes in and reviews our program, reviews our processes, and that's how it works all across our program. So they don't supervise us in the sense of personnel or governance, but they do supervise us in the sense of the programs and making sure we're doing what we need to do. They can put us in corrective action. They can take away money from us if we're not doing something right. They can actually, with the new law that I referred to, HB 630, they can actually take the program over. Which I think they don't want to do that because then they have to actually run it and say how hard it is. But I'm being bad about the state tonight. I shouldn't do that. But yeah, that's basically what it is. So we actually are county departments and county employees, which is, like I said, about 12 states I think that do that. The rest of them it's state administered.
Okay. Jason, this is for you. Are there any DPR dog parks, and if not, are there plans for one?
Whew. I'm gonna have to rely on Cynthia. We have several dog
There are
parks.
dog parks. I know. I applied for one.
Pineywood Dog Park, so in South Durham, attached to Pineywood Park. We have the Downtown Dog Park, which is just north of Holloway, off of Roxborough. We have Duke Dog Park, Northgate Dog Park.
Pineywood, the downtown Durham
Yep.
dog park, and we have one slated over by Edison Johnson.
Yep.
And so that one will be developed once we, receive the funding, and we are renovating Ralph Corey Park. So after those things occur, then we're gonna have the dog park there as well.
Hey Cynthia, will you hold up that play more?
Oh.
So next time you go to Harris Teeter, Food Line, or wherever you get your groceries, don't forget to pick up one of these books. It's free and it's in the lobby, and it will have all of the information in there about dog parks, where our facilities are at, and additional information related to the program, fee waivers. A lot of the stuff I talked about tonight is available. That document comes out 3 times a year with different recreation programs at those times.
And we're trying to be eco-friendly, so it is available online. If you absolutely have to have a hard copy, you can go to one of those places that Jason mentioned, or pick one up at the one of the facilities.
Yeah, don't try downtown. We're out downtown already.
All right, next, Gayle. Does the Tooth Fairy serve or visit college students? At my school, there were a lot of students who couldn't afford dental services but needed and wanted them.
The Tooth Fairy restricts its services to the elementary schools. There is a Smiles van that is a for-profit vehicle that also comes on site at some of the Durham public schools. But there are opportunities for dental care at Lincoln Community Health Center that would be at a sliding fee scale assessment. So they have recently expanded the facilities and added an additional dentist.
Thank you. So this is either for Deborah or Ben. Are natural parents allowed to have any in-person contact with their children while they are in foster care?
So shared parenting is definitely a process we do, and I will let Deborah talk about that.
We have to go what the judicial system tells us to do. DSS can make a recommendation. It is our hope that the child is not going to lose their parent altogether. It's our hope that the courts will allow if the parent has not done anything that was harmful to the child. So yes, there are shared parenting visits, not at your home. Normally, we have a place at DSS, or it could be at a McDonald's, someplace like that. Birthday parties, anything like that.
And of course, you gave us the answer, but if no, what would happen if parents just showed up at their child's foster home?
So what I'll say to that is, due to the internet, people can find where you live, and we teach this in the foster parent classes. There is a fear of that, but we tell people just like any other stranger, if the court says that that parent is not supposed to see the child, you need to call for the police and notify DSS that this parent has made a visit to your home. And try to do it in a way that the child is not affected.
This is for Jason again. When I moved to the Triangle, Durham, I was told, don't run, walk on the Durham Greenway. There's gang activity, it's prevalent, and you could get hurt. I have never run, walked, biked in Durham. What is being done to either make the Durham Greenway safer, remove the negative stigma, or both?
So I would say, when I moved down here, I was an avid cyclist and heard those same rumors. And I will say in the 5 years that I've been here, it's gotten better. It's not perfect. It's just like any other place in any other city that you go to. You have to be careful of what you're doing. But I will say this, the city is trying to increase patrols on the trails. We have the Durham Trail Watch, which is a group of volunteers that come out and they monitor what's going on in the trails, report to the police if they see something that's negative. The police have a small group that are on bikes that ride the ATT. And we're actually, the Recreation Advisory Commission, which is an advisory board to our department, actually has a subgroup or a committee that is working on potentially trying to increase security either through park rangers or by some other means at parks and all of our recreation facilities, which would include trails. So it's not perfect. We know that, and there are parts of the trail that are absolutely 100% safe, and there are some that aren't. But it's a very dynamic thing depending on who else is on the trail. But we are trying to take as many precautions as we can.
Thank you. Gayle, can you talk a little more about the program or your efforts which resulted in less gun violence and lower gang activity?
The evidence-based model that we're following is called Cure Violence. And you can Google it. It actually started in Chicago, where when an epidemiologist, Gary Slutkin, came back from working in Africa on communicable disease control. And when he saw the violence that was occurring in Chicago, he said the violence was just like a communicable disease. And in order to address the spread of communicable diseases, you have to interrupt the spread, so you have to stop it. And he looked at opportunities and to do this and identify people who had histories where they either were gang involved, they've been incarcerated, and they've served their time, and they still have the connections in the community. And so they go through some intensive training to show them how to work with individuals and to socialize them into working structure. We provide
a counselor for them because they put themselves in some really difficult situations. And so we look at the census tracts and determine where the greatest need is. And so the areas that they work are really kind of small. Right now, we're using the census tract around that McDougal Terrace is in, and part of South Side over. We don't cross over Enterprise Street, I think, but there's a part of South Side that goes to Fayetteville Street. And when they hear about issues, they bring people together. They may take them to restaurants or bring them to the health department or some other place and try to resolve the issues. We're about to put a person in the emergency departments at the hospital because, like, when people are shot, the group comes in, everybody's mad, and they're gonna go out and get somebody, and so we have these people who will be trained to de-escalate that and have them focus on the appropriate things at the time. It is a program that costs about $455,000 a year. We get information from the police department about shots fired and what's happening in the community, but the team does not work with the police department. You can understand that for obvious reasons. In Chicago, where this started, many of the programs have been defunded because they've been placed in nonprofits and there isn't sustainable funding. And so you have those high rates continuing, but there are areas in Chicago that have maintained lower rates. There are programs that are in New York that haven't had any gun violence in the areas in a year or so. And all the information that we have goes into a national database. So we've been doing this for about 3 years now. Great.
So I hate to cut it short, but I think we're about out of time for the Q&A.
Okay, let me get this one
Okay.
last question into Ben. What is the caseload size for CPS staff?
So Child Protective Services staff, they're the ones that investigate the reports that come in. We have an active caseload of anywhere from 140 to 240 at any given time. We move cases in and out. Each worker has, right now, the average caseload size for our workers is about 9, which is under the standard. They're not supposed to have more than 10. And that was due to this wonderful county helping us get some workers about a year and a half ago so that we could get our caseload standards right. But yeah, we have, depending on the active caseload size, we can have as much as 300 going on. Usually it's probably, I'd say we probably average about 230 active open cases at any given time.
Well, let's thank our guests. And I have kept the additional questions separate so that we can work on answering them and sharing them back out. Okay. Thank you, everybody.
Thank you. Enjoy.